stories. So I will invite now Mr. Marcelo Aebi, professor of criminology at the University of Lausanne. He had a PhD and a master's degree in criminology and a law master's degree in Argentina. He was invited several times to the university in New Jersey to lecture on criminology. He was professor of the criminology at the University of Sevilla and associate professor at the University of Barcelona. The main research areas include compared criminology, prevention measures, drugs and crimes, studies on self-denounced criminology. He is also executive secretary of the European Society of Criminology. Professor Aebi.
Press the button.
It is pressed.
It's pressed? Auziți pe domnul Aebi?
You hear it?
Now? It's better? Yeah. Okay.
So the organizers of this conference asked us to present in 5 minutes some reflections about the topic, and so I will send a clear message in these 5 minutes. First, the premises. In the summary of the panel, it indicated the place of juveniles and young offenders is not equal to other institutions, and I think there is clear agreement on that, practitioners levels. And indeed, even the legislations usually foresee that the criminal law is the ultima ratio, and within criminal law, imprisonment should also be the ultima ratio, the latest resort. On the other part, from a scientific point of view, the empirical research has shown that there are some negative labeling effects of imprisonment. So, on the one hand, this is clear. What should we do with minors? Also, in the abstract of this presentation, it said that put the access on institutions and organizations of civil society through partnership with public and private sector. That's perfect too. And then we arrive to the key issue of the panel. And they ask us to make a reflection on dissemination of good practices at the level of professional services and cooperating institutions. So for me, the main question is, which are the best practices? How do we know which are the best practices? And my answer is the ones who have been the object of an external evaluation, and this evaluation has shown that positive in terms of recidivism, but also in terms of general integration, in terms of education, family, and friends. I think that one important thing is that we should not continue repeating over and over again that the family is important, the education is important, because we know this, and it has been said many times. You can take a report from 1930 produced by the United States government, who says exactly the same. So, what works? On the internet, you will find a lot of that evaluate what is working. Probably the most well-known is the Campbell collaboration. But when you dig a little bit and you check which is the programs that have been evaluated, these programs come mainly from the United States and some of them from the UK. There is very little research in Europe. And this is very problematic, because otherwise, and I must be clear, I always say really what I think, and I thank Meridians for inviting me. But for example, I was surprised in the former session when it was said that in Spain the level of success of the system is 78%. I know relatively well, let's say, the literature on this. I have never seen a publication, a scientific publication published in a peer-reviewed journal mentioning a success rate of 78%. If this is true, then these results must be published immediately, and probably we will have people from all over point to Spain, because we have never seen a program with this rate of success. So it is important to publish that. And how do we get there? Probably why it is not published, because the evaluations must respect two rules, I would say. They must be external. You cannot do auto-evaluation, and this is the place for academics, and I suppose that is why we have some academics also here. And they must be based, as far as possible, on an experimental or quasi-experimental model. And at least you must check this program compared to another program. It's almost impossible, and probably it would not be ethical to eliminate the program from the control group, but at least you must make this quasi-experimental model. Why is this so difficult to achieve? Many times it is difficult to achieve. There are classic problems that you all know, but one of the main problems is that sometimes institutions that are conducting these programs are strict external evaluators. Because evaluators, they always bring bad news, as I'm also here saying, I'm very skeptical about what you're saying, and this is our role as social scientists. We cannot avoid. So the main thing to convince the institutions that are dealing with these programs to accept an external evaluation. And I think there are many advantages. At least three. Classic one is you can identify what is useless, and you're investing resources for nothing. But you can also identify some, what in medicine is called iatrogenic effects. So it's like giving a medicine that makes the situation worse. And in July there was a publication about probation of juveniles in the USA that shows that sometimes it is worse because the judges add new conditions. If you go to prison, you have this sentence, but if you go to a probation, then we will ask you not to do this, not to do that, not to do that, many external conditions. So, and this is negative. So a good evaluation will identify this, and then we can change the law and say to the judges, you cannot impose all these conditions. And then the third one is in a period like this one of economic crisis, when the budgets are being cut. If you don't have a solid evaluation, you don't have anything to fight against the cuts. If they decide to cut and you have an evaluation, you can say, okay, we did this and we know that this is working. And then if you have made a good evaluation, it is very easy to evaluate how much does it cost to have the person in prison, how much does it cost to have it in probation, and how much will it cost if you don't do anything. So you have a solid argument against cuts. And this is something that is very, for me, it's perfectly clear, but it's very difficult to transmit this idea. So in short, the program must be evaluated, the evaluation must be external, it must be based in an experimental or quasi-experimental model, and it must be published in scientific journals, in peer-reviewed journals, so that it is available for anyone to criticize, but also to adopt it. And then this conference could help the dissemination of these results. And the last point is, how do we achieve this? And this is a good point, because one of the main points in this discussion is also the participation of the civil society and also public and private partnerships. So the associations that are dealing with these programs should include in their budgets 5%, let's say, we can discuss maybe 4% is enough, to make an external evaluation. So this is my proposal also to Meridians. When you put foresee a small part of the budget to make an external evaluation, and then we will be able to show results to all these here about, in the former presentation they were discussing about how the taxi drivers think about restorative justice, and if you show results, this works. In Switzerland we have a very democratic system, and for example, when we introduced heroin prescription for drug addicts, many people said that we were crazy. The results were there, and when the people voted, they voted for keeping this program. So it will be exactly the same. We should not underestimate the capacity of every person to understand which is working, and also to understand which is not working. Thank you very much.
Thank you very much.
Bună ziua, sunt Laura Mureșan, de asistent social de profesie. Am o experiență de 9.
I'm Laura Mureșan. I'm a social assistant and I have a 19-year-old experience. I have reached the conclusion that we should work more with the parents. There are families that have problems from the very beginning. They have distorted behaviors. They need maternal assistance. We should try to prevent families with problems from having children. I believe there should be more. You are talking about prevention. So the question is about prevention.
So I didn't. You said prevent families from having children.
No, from the family with risks.
Yes.
Already.
And
can you prevent the situations like this? Is any solution?
So the question is, what should we do with the family? How do you know that the family is at risk? That would be the first question that I have. Just define the family at risk. How do you know before they have children that there's a family at risk?
Well, you think they have dysfunctional behaviors. They become more and more aggressive toward each other, maybe?
How do you know this? Because when the moment you get the family, they already have children. So it's too late to make an intervention. And I really think that the state must be very careful doing this kind of interventions. This is a very, very careful situation, thin ice, I would say, in which the state should not mix into the private lives of persons.
Well, the question, I think it was, the implicit question was that is it possible to make parenting courses for parents before being a parent? I mean, if you need that, maybe just do something.
This course is evaluated. A nice review by David Farrington about the effectiveness of these classes. The classic problem that you have is that the parents that go to these parenting classes are the ones that do not need them, because they are the ones who are reading all the books about how to raise a child before having them.
Bueno, yo creo que sí, cada vez está habiendo un poco más en los padres esa necesidad de estar un poco más formados de cómo llevar a cabo la educación. También hay escuelas privadas que se están haciendo por parte privada, no por parte privada, y acuden muchos padres. Se ha pasado, es que es una realidad, en la sociedad se ha pasado de una educación muy rígida a una educación muy laxa. Es decir, ahora los padres, muchos, o ahora, no quieren decir no a los niños, y eso no es una educación perfecta o buena, porque para el niño se sabe decir no, hasta aquí hemos llegado, y esto es un no, y punto, y lo que tiene que saber aceptar ese no.
Sorry, I cannot hear the translation from Spanish. When we know how to, for instance, the kid can say, look, this is what I want, and the kid may start yelling and jumping on the floor, but a parent cannot accept that. We need to teach youngsters or newlyweds how to educate their kids. I'll be ready in a minute. We have some schools for parents. They can attend those schools, and we can show them some models. We don't really need to educate them. We just need to let them know about these practices.
regarding this question, I would like to reflect that we do have some options in terms of universal preventive programs where we can promote positive and good parenting and caring parenting with different campaigns and with different programs. So that is something that is possible. But we are always going to miss some at-risk population with these universal programs. And then there is the question, how can we ensure the quickest reaction before maybe the problem becomes very obvious? One of the potential, in my opinion, are schools. Schools are the ones who are working with children on an everyday basis and with the behavior of children in schools and also with contact with families, they can identify that maybe something is going on here and maybe there are some risks concerning this child and his family environment. The question is, do we have really good reactions to those that we identify might be at risk? Because sometimes between schools who are not there to provide this type of treatment or counseling and the treatment where people who really have problems and are obliged by the court or some other system to work, in my practice I can see a gap between, for those who have not yet developed quite a lot of problems, but some preventive counseling for the better parenting would be good. And this is the gap that I can see in the system that we have.
Mai e o întrebare în spate.
There's a question at the back of the room.
You've spoken about education, you've spoken about families, you've spoken about communities. Is there a need to integrate better mental health care for some individuals who are implicated in the youth justice system? So for some individuals who are involved in the youth justice system, do they need better is there a need for better mental health care that might be linked to, you talked about families, you talked about education, you talked about communities. What about mental health care for some individuals?
Yes. But when you're talking about mental health professionals and mental health care, are you thinking about psychiatric treatment or would you include psychological, socio-pedagogical treatment?
Cheers. So I mean that if there's a greater incidence of mental health illnesses in individuals involved in mental health in the youth justice system, then are there sort of failings in the mental health care system?
Yeah.
Does that make sense?
Yeah.
Cool.
I can speak for Croatian circumstances. In order to include psychiatrist and health system, we must have a diagnosis. And in order to have we all know that diagnosis for the young people and children are limited, and which is good, which gives a different sort of protection for the labeling. The place where we mostly include health system is with addiction problems and with problems if we have some elements of potential personality disorders which cannot be diagnosed before the age of 18 or even after that, but we can see different elements of personality disorder, or there have been some psychosis or these elements of psychiatric issues and diagnosis. Other than that, we usually do not include health system. I mean, these are different levels. You can work on the integration on the schools at the macro level and at the neighborhoods at the macro level. If you go to the individual, then at the micro level, of course, if the person has a pattern which requires a psychological intervention, all countries will do that. I think it's very important not to generalize a lot. I see what your point about parents being more or less rigid. It's true, but it's not true everywhere. So what you have now in Western Europe, for example, many small families, middle-class families with only one child, and this, I can see the point, but this requires careful study because there are huge differences between different persons from different backgrounds in the number of kids that they have, in the raising styles of the children. So generalizations are inevitable on the one hand, but they must be done very carefully. And so for the psychological intervention, this is a clear case where you need to individualize at the maximum the intervention.
Cannot hear very well. Something about lunch. She doesn't have a mic. So after lunch at 5 minutes past 2.
Vă mulțumim foarte mult, vă invităm la prânz, revenim la 14 și 15 minute în aceeași sală cu alți lectori și cu alți invitați. Poftă bună!
Enjoy your lunch and we'll be back in 45 minutes. Thank you very much.